I am in mental health because I am driven to care. I'm driven to help. I'm Rick Gertzma. I'm a licensed psychologist and I'm the mental health senior advisor with the Miller-Dwan Foundation. I have been working in the field of behavioral health since 1982. My passion for behavioral health really is out of the incredible privilege of being able to work with kids, adults, families at what is likely the most vulnerable time of their life. To be with them, to be present, to understand, to be empathic. I think we're still living the pandemic, and I think that we have a number of years to maneuver to continue because there's a sustained grief and sustained change and this desire to get back to what we would consider normal. The Miller-Dwan Foundation has historically focused on mental health and rehabilitation. The board decided that they really wanted to take a look at mental health and how could the foundation itself have a revolutionary response to the pandemic and the mental health crisis. Out of that strategic plan really was then born the idea of a mental health advisor. And from there, then, now let's start addressing and taking a look at what's happening globally and nationally, and how can we learn from what's happening in a global response to the pandemic and bring that to Duluth, Minnesota. The vision for the Miller-Dwan Foundation is all coming together in HopeX. HopeX is how do we multiply community healing. Our goal with HopeX is that if you are struggling in your own community, in your own work environment, that we could help create a way in which you could reach out to somebody right in the community. And if we can do that, we could change and transform so that people don't get to crisis. My hope for the future in the work that's happening at the Miller-Dwan Foundation is that we will transform care. We will bring the community together. We will become the hub for mental health. Join us in the effort, because the more people we have involved, the more contagious it becomes, and HopeX really becomes multiply, until we have our entire community and maybe the entire state joining together in an effort to deal with the mental health crisis.